We now have the Health Minister of Assam, Himanta Biswa Sharma. Mr. Sharma, thank you very much for joining us. When you look back, do you feel that perhaps a three-phase election could have been crunched into one to avoid large congregation?
We have analyzed data in Assam and we found that mostly COVID positive cases has been found with the people who have travel history. Either they have been tested positive in railway station or airports. We have not able to establish any data connecting election rallies vis-a-vis COVID positive cases. Most of our COVID positive cases are from the people who have come to from Delhi, Mumbai, Bangalore, and they have come mostly for business purposes and other related activities, nothing to do with the election.
Okay. Mr. Sharma, would you like to tell us about the situation of beds, oxygen, Remdesivir, vaccines in your state? Is it available in good supply because there's a huge crisis?
First of all, we have vaccinated almost 12 lakhs people as of now. So far as vaccine is available, we have 6,07,000 doses are available as of now in our state. So far as Remdesivir is concerned, we have 12,000 vials with us, and hopefully in next 10 days we are going to get another 10,000. So we do not have shortage of vaccine and Remdesivir injection. So far as oxygen supply is concerned, we have capacity, we have storage and production capacity of 300 metric ton daily. Against that, as of now, we are using 40 metric ton daily. So, Remdesivir, oxygen, ICU beds and vaccines, all these positions are as of now stable so far as Assam is concerned. But of course, you never know when cases will see some more cases, whether the companies will be able to provide us Remdesivir or not. Those are the questions, but as of now, we are comfortable.
Yes, but Mr. Sharma, do you think that the pace of vaccination needs to be increased now? And what's the time frame that you're actually looking at?
Obviously, with the rise in COVID cases, the demand for vaccination has gone up. Earlier, in our vaccination center, people were not coming up the way now they are coming up. So the demand for vaccine has gone up. It is obviously, we have to see the supply side also, because it always takes time to increase the capacity. I am sure that Government of India is giving due attention to this and will get adequate stock as and when it is required. But at the same time, it is not that we should both the Covaxin and Covishield people can overnight increase their capacity and supply. So all these have a particular, you have to go in a manner which is scientifically acceptable. That means if you want to increase the production capacity of a particular say Covishield, I want to increase capacity from 1,000 to 2,000. You cannot do overnight. You have to comply with all the regulatory requirements. So we have to understand the compulsion of those companies who are supplying us vaccine today.
True, I can understand, but the criticism is that these compliances could have been done at a time when it was relative peacetime and not wartime like this. Mr. Sharma, my final question, the virus this time around seems to be affecting more young people. In a situation like this, do you think prioritizing vaccination for them should be most important?
It is all, first of all, young generations are being protected. But at the same time, India as a country, we owe a lot of responsibility to our elders. So at all time, I will prefer that elders should be protected first. That is the dharma, that is the Sanskriti, that is the way of how we live in India. So I do not want to take a vaccine at a cost of my father. So I think the elderly should be given vaccine at priority. and subject to the availability. Of course, young people should also be included in, but priority should always be given to the elders.